Food cravings are a common experience for many people. Sometimes they're simply a sign of hunger or a desire for a particular taste. However, there are situations where cravings can signal something more serious. In this video, we'll explore which symptoms, when paired with food cravings, mean you should seek urgent medical care. Understanding these warning signs can help you protect your health and know when it's time to take action. Let's start by looking at what food cravings are and why they happen. Food cravings are intense desires to eat specific foods, often high in sugar, salt, or fat. They can be triggered by emotional states, hormonal changes, or even nutritional deficiencies. While most cravings are harmless, persistent or unusual cravings can sometimes indicate underlying health issues. It's important to pay attention to how often you experience cravings and whether they're accompanied by other symptoms. Let's discuss some common causes of food cravings before moving on to the warning signs. There are many reasons why people experience food cravings. Emotional stress, hormonal fluctuations, lack of sleep, and certain medications can all play a role. Sometimes, cravings are simply a response to seeing or smelling delicious food. However, when cravings become frequent or uncontrollable, it's worth considering whether there's a deeper cause. Let's now focus on the symptoms that, when combined with cravings, require urgent attention. Most food cravings are not dangerous, but if you notice certain symptoms alongside your cravings, it's important to take them seriously. These symptoms can be signs of underlying medical conditions that need prompt evaluation. In the next scenes, we'll break down the key warning signs to watch for and explain why they matter. If you experience severe abdominal pain along with intense food cravings, this could be a sign of a serious digestive issue. Conditions like appendicitis, gallstones, or bowel obstruction can cause both pain and changes in appetite. Severe pain that doesn't go away or gets worse should never be ignored. Seek urgent medical care if you have these symptoms together. Sudden confusion, trouble thinking clearly, or disorientation, along with food cravings, can be a sign of dangerously low blood sugar or other metabolic problems. This is especially important for people with diabetes, but it can happen to anyone. If you or someone you know becomes confused or has trouble staying awake, seek emergency help immediately. Fainting or losing consciousness is always a red flag, especially if it happens alongside unusual food cravings. This could indicate a serious underlying problem, such as a heart issue, severe dehydration, or a neurological disorder. Immediate medical attention is necessary to determine the cause and prevent further complications. Shortness of breath that occurs with food cravings is not normal and could be a sign of a heart or lung problem. Conditions like heart attack, severe allergic reactions, or asthma attacks can present with changes in appetite and difficulty breathing. If you find yourself struggling to breathe, call for emergency help right away. Chest pain or a feeling of pressure in your chest, especially when combined with food cravings, can be a sign of a heart attack or other cardiac emergency. This is a life-threatening situation that requires immediate medical attention. Don't wait to see if the pain goes away. Call emergency services right away if you experience these symptoms. A sudden, severe headache that comes on with food cravings could be a sign of a neurological emergency, such as a stroke or brain hemorrhage. If you experience the worst headache of your life, especially with other symptoms like vision changes or weakness, seek urgent care immediately. If you notice unexplained weight loss along with persistent food cravings, this could be a sign of a serious underlying condition, such as diabetes, thyroid problems, or even cancer. Rapid weight loss without trying is always a reason to see a doctor, especially if you're also experiencing other concerning symptoms. Persistent vomiting or diarrhea, especially when paired with food cravings, can quickly lead to dehydration and electrolyte imbalances. These symptoms may indicate infections, food poisoning, or other gastrointestinal emergencies. If you can't keep fluids down, or your symptoms last more than a day, seek urgent care. A high fever along with food cravings could be a sign of a serious infection or inflammatory condition. If your temperature is above 102 degrees Fahrenheit, 39 degrees Celsius, and you have other symptoms like chills, confusion, or severe pain, it's important to seek medical attention right away. Severe fatigue or weakness that comes on suddenly with food cravings can be a sign of a serious medical condition, such as anemia, infection, or metabolic disorder. If you feel too weak to stand or perform daily activities, don't ignore these symptoms. Get checked by a healthcare professional as soon as possible. Unusual swelling in your legs, face, or abdomen, especially if it appears suddenly with food cravings, may indicate heart, kidney, or liver problems. Swelling can be a sign that your body is retaining fluid due to a serious underlying condition. If you notice new or worsening swelling, seek urgent care. Difficulty swallowing, known as dysphagia, is a concerning symptom when it appears with food cravings. It can be caused by blockages, infections, or neurological problems. If you suddenly have trouble swallowing or feel like food is stuck, seek medical help immediately. A severe allergic reaction, or anaphylaxis, can sometimes be triggered by food cravings if you eat something you're allergic to. Symptoms include swelling of the face or throat, difficulty breathing, hives, and rapid heartbeat. This is a life-threatening emergency call for help right away if you suspect anaphylaxis. Persistent dizziness or feeling lightheaded, especially when paired with food cravings, can be a sign of low blood pressure, dehydration, or a neurological issue. If you feel like you might faint or lose your balance, it's important to get checked by a doctor as soon as possible. Sudden changes in vision, such as blurriness, double vision, or loss of vision, are always concerning, especially if they occur with food cravings. These symptoms could indicate a stroke, migraine, or other neurological emergency. Seek urgent care if you notice any sudden vision changes. Numbness or tingling in your arms, legs, or face, especially if it comes on suddenly with food cravings, can be a sign of a stroke or nerve problem. If you experience these symptoms, especially on one side of your body, seek emergency medical attention right away. A rapid or irregular heartbeat, known as palpitations, can be alarming, especially if it happens with food cravings. This could be a sign of a heart rhythm problem, anxiety, or other medical condition. If your heart is racing and you feel unwell, seek urgent care. Severe mood changes, such as sudden depression, anxiety, or agitation, can sometimes accompany food cravings. These changes may be related to hormonal imbalances, metabolic issues, or mental health emergencies. If you or someone you know experiences drastic mood swings, seek professional help. If you notice that you're bleeding or bruising more easily than usual, especially with food cravings, this could be a sign of a blood disorder or liver problem. These symptoms should not be ignored, as they may indicate a serious underlying condition that needs prompt evaluation. Dark urine or pale stools, especially when combined with food cravings, can be a sign of liver or gallbladder problems. These symptoms may indicate a blockage or infection that requires urgent medical attention. If you notice these changes, don't delay seeking care. A persistent cough or hoarseness that doesn't go away, especially if it's new and occurs with food cravings, may be a sign of an infection, allergy, or even cancer. If your cough lasts more than a few weeks or is accompanied by other concerning symptoms, see a healthcare provider. Swelling of the face or throat is a medical emergency, especially if it happens suddenly with food cravings after eating. This could be a sign of a severe allergic reaction, which can block your airway. Call emergency services immediately if you notice this symptom. Difficulty speaking, slurred speech, or trouble finding words, especially if it comes on suddenly with food cravings, can be a sign of a stroke. This is a time-sensitive emergency. Every minute counts. If you or someone else has trouble speaking, seek emergency care immediately. Loss of coordination or trouble walking, especially when it happens suddenly with food cravings, can be a sign of a neurological emergency, such as a stroke or brain injury. If you find yourself stumbling, unable to walk straight, or losing balance, seek urgent medical attention. Seizures are sudden, uncontrolled electrical disturbances in the brain. If you or someone you know has a seizure, especially with new or unusual food cravings, this could be a sign of a serious neurological condition. Call emergency services immediately if a seizure occurs. Severe dehydration can develop quickly if you're experiencing vomiting, diarrhea, or excessive sweating along with food cravings. Signs include dry mouth, sunken eyes, rapid heartbeat, and confusion. If you can't keep fluids down or feel very weak, seek urgent care. Persistent nausea that doesn't improve, especially when combined with food cravings, can be a sign of gastrointestinal or metabolic problems. If you feel nauseous for more than a day or can't keep food down, it's time to see a healthcare provider. Seeing blood in your stool or vomit is always a cause for concern, especially if it happens with food cravings. This could indicate bleeding in your digestive tract, which requires urgent evaluation. Don't wait, seek medical attention immediately if you notice blood. Craving non-food items, such as dirt, clay, or ice, is known as pica. This can be a sign of nutritional deficiencies or other medical conditions. If you find yourself craving substances that aren't food, talk to a healthcare provider to rule out underlying problems. Severe anxiety or panic attacks that occur with food cravings can be overwhelming and may indicate an underlying mental health condition. If you experience chest pain, trouble breathing, or feel like you're losing control, seek urgent care to ensure your safety. Night sweats that soak your sheets, especially if they're new and occur with food cravings, can be a sign of infection, hormonal imbalance, or even cancer. If you experience persistent night sweats, see a healthcare provider for evaluation. Persistent itching, especially if it's all over your body and occurs with food cravings, can be a sign of liver or kidney problems, allergies, or even some cancers. If you can't find relief or notice other symptoms, seek medical advice. A sore throat that doesn't improve, especially if it's new and occurs with food cravings, may be a sign of infection, allergy, or even cancer. If your sore throat lasts more than a week or is accompanied by other symptoms, see a healthcare provider. Persistent hoarseness, especially if it's new and occurs with food cravings, can be a sign of vocal cord problems, infection, or even cancer. If your voice doesn't return to normal after a few weeks, consult a healthcare provider. Persistent pain anywhere in your body, especially if it's new and occurs with food cravings, should not be ignored. Pain can be a sign of infection, inflammation, or other serious conditions. If you have ongoing pain, see a healthcare provider for evaluation. Swelling that doesn't go away, especially if it's new and occurs with food cravings, can be a sign of infection, injury, or other medical conditions. If you notice persistent swelling, especially with other symptoms, seek medical advice. A fever that doesn't go away, especially if it's new and occurs with food cravings, can be a sign of infection, inflammation, or even cancer. If your fever lasts more than a few days or is accompanied by other symptoms, see a healthcare provider. A rash that doesn't go away, especially if it's new and occurs with food cravings, can be a sign of allergy, infection, or autoimmune disease. If your rash persists or spreads, seek medical evaluation. Vomiting that doesn't stop, especially if it's new and occurs with food cravings, can be a sign of infection, obstruction, or other serious conditions. If you can't keep food or fluids down, seek urgent care. Diarrhea that doesn't improve, especially if it's new and occurs with food cravings, can be a sign of infection, inflammation, or other medical conditions. If your diarrhea lasts more than a couple of days or is accompanied by other symptoms, see a healthcare provider. Food cravings are usually harmless, but when they're accompanied by certain symptoms, they can signal a serious medical problem. If you notice any of the warning signs we've discussed, such as severe pain, confusion, fainting, or persistent symptoms, don't hesitate to seek urgent care. Your health and safety are always the top priority. Stay informed, listen to your body, and reach out to a healthcare professional whenever you're in doubt. Thank you for watching, and take care of yourself.